Miss Anderson, I got your pills here, okay?
Okay.
Alright, you doing alright?
I just having a little trouble breathing.
A little trouble breathing.
Uh-huh.
How do you want to take those? You got them?
Yeah.
Okay. Alright.
Thank you.
Awesome. Let me check your stats real quick. Alright, can you put that on your finger? Awesome. Well, you're doing really well on your pulse line, so that's fine. Running about 82. Okay?
Okay.
I'll see you in a little
Whatever
while.
you say.
Alright, sounds good. I'll see you in a little while.
Okay.
You have the patient in 29A?
Right. Miss Anderson, the Cooper woman.
Cooper woman.
Yeah, she's short thing, and bless her heart. She's gonna be all right though. She's 70 years old, she's a female, obviously, and full code. She was admitted with chest pain. She has a history of COPD, CHF, and AFib. I went in there and assessed her this morning. All lung fills, bowel sounds were present, clear. She's had her AFib rate today. Given her warfarin, and she's asymptomatic. She did have bowel sound or a bowel movement times 3. It was quite an ordeal. The tech told me about it. But yeah, and then her pulses, they're all 3 out of 5, radial, dorsal. I palpated them. Didn't have to use a Doppler. Her pain rating was 0. She was up and walking today down with PT. I seen him take her down the hallway on the stroll. She did have a bath, and she's just a pleasant lady. I checked on her a few times, and left her be. She didn't call out for nothing.
Is there anything else?
Yeah, not really. I got to finish my assessment so you guys can look that over, but about it.
Well, thank you.
Mm-hmm.
All right, Chelsea, so Derek has a history of false assessment, and so we're going to go in this morning and assess the patient and see how she's doing. I've actually had her before, and she's got the history of the COPD and the heart failure. Last time I had her, she wasn't doing as well as he said, so I'm a little concerned that it's inaccurate.
Well, I noticed that he called her the Keebler woman, and that just seems awfully derogatory towards the patient.
That's not right or professional, and you want to try not to give nicknames to any patient while they're here.
Right.
So let's go ahead and assess her. And
Okay.
just to give you a little tip, when you start working, you got to learn who to trust and know right from wrong, so that in situations like this, you can take care of it.
Right. Thank you.
Good morning, Miss Anderson.
Good morning.
Good morning.
My name's Erin, and this is Chelsea. She's a nursing student. We're going to be taking care of you today. We're going to go ahead and get your assessment this morning, okay?
Okay.
Are you having any pain?
Yeah.
Where's your pain at?
Mainly in my chest.
Your chest.
I'm going to see this arm. I'm going to get your blood pressure, okay?
Are
Okay.
you coughing up a lot
I am.
this morning? Okay.
How do I sound?
There's some crackles in there.
Okay.
Could you rate your pain for me on a scale of
It's
1 to
about
10?
5.
5, okay. I'm just going to check your feet, okay?
Okay.
Can you squeeze my hands?
Sure. Bowel sounds.
You're really swollen today.
I
Do
can
you
actually
always do
feel
this?
it. And it's not there every day, but I can feel it today.
Well, I can't really seem to find your pulses while you're this swollen, so I'm going to use a Doppler, which
Okay.
just lets me hear, okay?
Okay.
Which I can find them, but it's very weak.
Okay.
You got her vital signs?
I do. I have them
Okay.
written down. I'm gonna move this closer to her in case she gets thirsty.
Good, I was thirsty.
And I also noticed that the board hasn't been filled out today.
Oh, I see that it hasn't.
Can you reach everything, Miss Anderson?
I can, thank you.
Do you need anything?
Might be good if I got up and went to the bathroom.
Do you
I
need,
haven't been up yet.
You haven't been up at all today?
Uh-uh.
Okay, do you need help when you get up?
Yeah, I'm as weak as I feel. I probably should have the help.
Okay, I'll help you.
Okay. Thank you.
Okay, there's your call lots
Thank you.
and your water and your tissues. Can I get you anything else?
No, I think I'm good right now.
Okay.
During the assessment, I heard wheezing, congested and coarse lung sounds. She was in tachycardia and she had 4+ pitting edema. What did you find with the Doppler?
I found her pulse. It was just very weak. It was really hard to hear because of her edema in her legs. But I also noticed when we were walking in that she was using her expiratory muscles to breathe. So, and she had no oxygen on. So should we maybe check about getting some oxygen? But I know with her COPD history, she can't go above 2 liters.
Right.
So how do we address that? Because her oxygen was 85% when I did her vital signs.
Well, we'll go ahead and address that. We'll call the doctor and see what he wants to do.
Okay.
And right now, because of this situation, let's go talk to the shift charge, Lauren, and see what she wants us to do about it.
Okay.
Hey Erin, hey Chelsea.
We just wanted to come and talk to you about a situation. We came this evening and assessed Ms. Anderson in 29A. We found that Derek yesterday falsely assessed all of her documentation and his assessment.
Made her sound healthy.
He made her sound healthy. Everything was normal. Pulses and lung sounds were good. But when we went in and did her assessment, that wasn't the situation. She had coarse lung sounds, pitting edema, 5 out of 10 pain. So we just wanted to see what you wanted us to do about it.
Oh, okay. This is a major concern and needs to be addressed right away. So let's let the unit manager know about this. Hey guys, what's going on?
Derek, in the day shift, has seemed to falsely assess Ms. Anderson's assessment and other things during the day yesterday. So we weren't sure what to do about it.
Basically, he told us her history. She's a COPD patient, CHF patient, AFib patient, and all of his assessment made her seem healthy. Like her lung sounds were clear, that she had no edema, that she's a walkie-talkie patient, doesn't need assistance up or anything. But when we went in to assess her, she is coarse and congested in her lung sound. She's got 4+ pitting edema, and I had to help her to the bedside commode.
Well, this is definitely a situation that needs to be addressed. I do understand, that Derek does only have 3 days left here on our floor before he starts his new job. The situations like this can affect his license anywhere. So, just make sure that you're charting everything correctly, just as you find it, and I will take care of this issue. Just make sure that you are providing the best patient care possible and do your job correctly, and I will take care of everything else, okay? Thank you.
So I see here that her plan of care hasn't been initiated either, so I'll go ahead and let you do that and let you document her true assessment, and we'll make notes on each of Derek's documentation assessments, why they're not correct, and fix those as well.
Okay.